Hi, my name is Erin Coakley, and I am doing Unit 10's Crisis Management presentation. This particular one is over patient number 2, who is a 19-year-old married female with a 2-month-old baby for her 4th visit. Her husband has accompanied her today for this appointment. She presents today dressed more provocatively than I have seen before. Her makeup is heavier than usual. The baby is in the carrier and is sleeping. She immediately starts discussing a video series on aliens she has been watching. Her speech is rapid, loud, and tangible. She makes several looseness of associations between the video series and her baby. From her rambling, it seems as if she believes the baby is an alien and she needs to take the baby to the desert and leave it on the mountaintop for the aliens to come and retrieve it. She reports making plans to go camping with the baby and her husband this weekend. I questioned her about suicide and homicidal ideations, and she denies both. The husband states that she has been acting different for a couple of weeks, um, and she has never behaved like this before, and he is scared to leave her alone with the baby. She interjects that she knows the secret to world peace, and giving their baby back to the aliens will accomplish this. So, my next steps would be the patient appears to be having a manic episode. Um, Further information will be needed to see if she has a diagnosis of bipolar. Although, due to the patient being a recent mother, she could be experiencing postpartum psychosis. Um, and that includes delusions. It includes delusions, hallucinations, mood, which is such as, like I said, the mania, increasing activity, depersonalization. I guess some people describe this as being an out of body experience. Um, she hasn't expressed that she's had insomnia or trouble sleeping. She didn't express irritability or agitation, and she denied thoughts of self harm or homicidal ideations. So, treatment for her would definitely be to oh, monitor monitor her so she would not put the baby in harm's way. Postpartum psychosis is viewed as a psychiatric emergency due to um, the possibility of them harming themselves or harming their baby. So immediate hospitalization will be ensued to ensure the safety of the mother and the infant. We want to rule out any medical conditions such as thyroid disease. Make sure that the mother doesn't have an infection or electrolyte imbalance, or if she has been using any substances such as illicit drugs and alcohol. We want to rule all of that out. But we do want to, safety is the main priority for the patient. Safety of the patient and most definitely safety of the baby. So by initiating hospitalization, we can help prevent any further damage to the patient or their infant. Um, the initiation to help to tackle the hallucinations and the delusions, we can use second generation antipsychotics, such as Seroquel or Risperidone. You can also, due to because even though she wasn't diagnosed with bipolar previously, she could have some underlying bipolar that's undiagnosed. So we can also initiate mood stabilizers to help her. So lithium can be used for this because it has a strong evidence for postpartum psychosis prevention and treatment. Um, Benzos could be used short term as a for agitation, nothing long term, just something to help get a hold of her symptoms. um, that would be more therapeutic for her. But again, safety, safety, safety of the mother and the infant is important in this scenario. And so that will be the main focus. Thank you.